I am Ma'am Lumen, and today I am going to talk about, of course, together with my expert guest, the 5 telltale signs that you should see a dentist. I am Lumen Tamayo, and I am your devoted planner from Insular Life. I help millennial mothers who believe that being prepared in times of crisis is important in building their family's future. Okay. From feeling anxious, uncertain, and not in control to being confident and financially responsible by learning how to manage their household, manage their time in balancing role as a mother and working from home so that they can remain healthy and sane in helping their partners build their family's future. Over the past 3 years, I have helped more than 30 individuals who are in search of ways on how to be on track with their family's goal of achieving a sustainable financial plan. By getting a life insurance with the dreaded disease rider, they are confident and with peace of mind that when they get critically ill, they have enough funds to use for their medical treatment so that they don't need to be in debt or even beg from family and friends, giving them that sense of fulfillment that they can take care of themselves and that all they need to think of is getting better. This afternoon, I have invited a very good friend and a sister also in our community who happens to be a dentist by profession to share with us her expertise on the subject matter. Yan. So why did I choose this topic? Because during this pandemic, one of the riskiest people to see is your dentist. I want us to understand and to know ano ba yung mga signs that we need to see a dentist. Baka naman kasi we're just feeling paranoid and we don't really have to see one. Okay. So just yesterday, I met with a former high school classmate who is a dentist also by profession. And she's sharing with me that she did not open her clinic since the lockdown last year. So kahit naman gusto nating makipagkita sa mga dentist, we have to agree or we have to admit na maraming mga dentists ang hindi nag-open ng clinic. Later on, we're going to ask our guests, why is that so? Because, what if we really need to see one, right? And also, I am sure that all of the mothers out there who are watching me live right now and who are going to watch this on replay, one of the things we wish for is that our kids will never experience during this time, aside from coughs, colds, and fever, toothache. 'Di ba mga mamshies? So, sino mag-agree sa akin dito na ayaw natin magka-toothache ang mga anak natin? So, at this point, I'm going to bring in already my guest. But before that, let me just introduce her very briefly. Okay, her name is Dr. Ann Bondoc Irigo, okay, she is a dentist by profession. Her specialization is general dentistry and also orthodontics. Okay, she's also the vice president of Jade Hotel. Yan. Because her family runs a hotel in Makati. Later on, we will ask her, okay, to share about that. She also holds her clinic in that same building. So, without further ado, let me bring in my guest now. Okay. A minute. Pag live talaga. Yes. I'm going to add her now. Bakit hindi ko siya ma-add sa stream? Sandali lang. Let me just very quickly. Ayan na. O yan. Hi, Anne. Good afternoon. Would you like to greet our audience, televiewers talaga, no? Nakikita yung generation. The people who are joining us here live on FB.
Good afternoon, everybody. Happy Mother's Day. All the
Yes,
moms
of
she's
course.
there.
Tama. For all the momshies out there, happy Mother's Day. So, Anne, I'd like to ask you very briefly, would you like to just give us a brief background of your experience as a dentist?
Okay, I've been actually practicing for 20 years already. So, I graduated in 1999, and from After that, I studied again to be an orthodontist, and then from then on, I've been on my own in my private practice for let me see, 17 years, I think. Because 3 years before that, I worked for another dentist.
Okay, thank you. So being a dentist for the past 20 years and also a mother, what is the most difficult case that you've handled of children?
Oh, okay.
You also
Those,
deal with children, ba?
yes, I do, I do. Of course, the hardest part is yung mga crying kids, the ones who are really scared to go to the dentist, yung wala ka pang ginagawa, umiiyak na. So,
Okay. So
you
meron
have
ka
to
bang
handle
naging
that.
experience na ano dyan? Meron ka bang naging experience na dahil yung bata umiiyak ng todo, hindi mo na nagawa yung procedure?
Oh, so far hindi naman. Pero there was this time that it took me like, what, more than 30 minutes just to extract a mobile tooth. Ibig sabihin yung gumagalaw na ng ipin. Sobrang takot lang niya talaga. So parang it took me a while for me to calm the child, convince him na okay lang, ganyan. So,
Being a mom, no, and a dentist, was it difficult for you to treat your own kids? Or mas madali lang kasi anak mo naman sila?
okay naman, ano sila, for me, it's the same. Hindi pa naman kasi nangyayari yung I will do surgery on them. Let me see when I cross that time. But so far, it's I treat them the same way as I treat my other patients.
What is your tip to moms so that they will be able to convince their kids to see a dentist even before they experience a problem? Go ahead, Anne. What is your tip
Okay, my
that you
tip,
can give to the moms?
I always tell the parents, when they bring their kids, to bring them when their kid is not experiencing pain. As much as possible, bring them for a regular checkup. Just
Mhm.
cleaning, or for just to let them experience being inside the dentist clinic. Kasi if you bring your kids na kailangan ng bunutan, and then they'll have this memory that ay, pag pupunta ako ng dentist, ang masakit, 'di ba?
Mhm.
Nakakatakot. Kasi that's the first thing that's the thing that's in their head. So mas maganda na bring them na check up lang. So it's very nice yung experience nila. Or minsan pag very young, below 3, because I still see kids below 3, bring them lang, experience yung pag-upo sa chair,
So
knowing the
meron bang ano
instrument.
dyan? Meron bang
Mm.
minimum age na kailangan na nating i-introduce yung mga bata to see the dentist para nga maging familiar sila doon sa idea na they have to see a dentist on a regular basis?
Ideally, during the first year of life ng bata.
Wow, as early as 1 year old.
Yes, but of course, hindi masyado siyempre dinadala yung mga kasi meron tayong mentality na baby teeth pa lang,
Mhm.
not really important, ganyan. Tapos dadalhin na nila when it's like 5, 6 years old when it's starting to show cavities and problems already. But, as early as that, or if not, maybe yung mga 2, 3 years old. 3 years old, they can remember stuff already.
So
So,
parang sinasabi mo, just bring the child to the dentist kahit na
yes,
walang agenda. Tama?
yes,
Para lang
that's right.
makita nila, para lang ma-familiar sila, no, do'n sa idea na meron tayong aside from their pediatrician. Kasi 'di ba peda isa rin 'yan na sumisigaw sila kasi tinuturukan sila, 'di ba? So
Oh, di
parang
ba? Doon may injection. Dito wala.
oo, correct, correct. Para by the time na kailangan na nila ng treatment, familiar na sila doon sa setup, 'di ba? Or doon sa dentist nila, ganyan. No? So, ako, ang basic agenda ko for this afternoon, I want to ask Dr. Ann, what are the 5 telltale signs that we need to see a dentist, whether you're an adult or a child during this pandemic? Because I'm sure a lot of our mom, she's here, and also pop, she's in the case of Edric, no, takot tayo to see a dentist. Or even if we are not afraid, malamang yung dentist natin hindi nagki-clinic. So yun, first telltale sign. What do you think, Anne?
Well, of course, yung pinaka-common is pain. Okay. These are pain na talagang hindi na nawawala when you drink paracetamol
Pain
or
reliever.
methadone acid, the pain relievers that you have at home. You go there to have it checked. Kasi minsan, it's not just a cavity. Maybe there's an infection already or another problem like maybe an impacted tooth. So, yun. Pain is the number
So,
one reason na
okay,
hindi
number
nawawala.
one daw. Mga mamshies and papshies, excruciating pain that does not go away even if you take medicine. That's number one.
Yeah.
What a second telltale sign?
Okay, another is meron tayong swelling or swollen gums, bleeding gums.
Swollen. Okay,
Yes,
swollen or bleeding gums. That's
swollen or bleeding.
another. Okay, ano
Yes.
bang sign yan kung ganun yung na-experience natin?
Oh, madami kasing reasons yan eh. Ang pinaka-common is yung madami tayong tartar sa mouth natin kasi hindi nga na tayo nag-clean ng teeth. Even though we brush very well or floss every day, we cannot avoid na meron talagang tartar na nag-form at the back of your teeth. So, only the dentist talaga can remove that. And pag sobrang dami na niyan, it causes bleeding of the gums. So, eventually, it will cause a bigger problem pag hindi natanggal. Sometimes it's also because of a systemic disease. Sometimes it's diabetes or sometimes naman sobrang, kung hindi naman swollen, what do you call this, signs of another infection. Like,
Okay. So pag sinabi mong, sorry pag sinabi mong bleeding, ano ba yan? Bigla na lang siya magdudugo or dahil
when you brush your
when you
teeth.
brush?
When
Kahit
you
na
brush your
gentle?
Yes. Oo, pag na-touch ng konti, it bleeds. Bleeds. Pag gano'n na, talagang you have to see your dentist. Sometimes kasi masyado lang madiin mag-toothbrush kaya nag-bleed. Pero yung slight touch,
Correct.
yeah, so that's when you
Or
have to see
minsan
your
pag nag-floss, di ba, merong friction.
Mali yung
Oo.
pag-floss. Mali yung
Ha?
pag-floss. Mali yung pag-floss.
Oo. Meron bang recommended type of floss that is best to use so that to avoid yung mga ganong klaseng friction? Will you recommend, not a brand, but at least the
I
type of
think
floss?
it's more of the technique on how you floss. Some really floss so hard that they push yung pag-push nila ng floss in between the teeth towards the gum, nabibreak na yung attachment ng gum sa teeth. That's why it's bleeding. So, dapat gentle. You follow.
Na-imagine ko yung sinasabi mo kaya napapano ko. Okay.
Dapat
Alright. So talagang dapat pala mga mamshies, we have to be very particular when we teach our kids how to use dental floss. So there's two already, the pain, then you said the inflammation, and the third I think is the bleeding gum. Kasi pwedeng inflame pero hindi naman siya nagbi-bleed, di ba? So those are three already. What is the fourth telltale sign that you can share with our audience now?
Okay. One is, another one is mouth sores. Mga singaw. Mga singaw
Okay.
na, meron kasi mga singaw na hindi ka agad nag-heal. So you have to show us what it is so that we can prescribe the correct medicine. Some kasi are caused by viruses. Hindi lang because of trauma, nakagat, natusok, nabugo.
Question dyan ako, no? Let me cut you there, doktora. So pag sinabi mong mouth sores tapos hindi gumagaling, ano ba yung expected number of days that it can get better? With let's say sometimes sabi mo, 'di ba sabi, I remember my dentist would tell me pag meron akong sigaw, just use yung gargle, ganyan.
Yes.
The most common is the warm salt water
Yes.
gargle. No?
Yes, that's right.
So mga ilang araw ba pagka hindi pa siya nawala, kailangan na nating pumunta sa dentist?
Okay. Usually kasi, especially if it's a virus, no? Pag virus siya, mga 1 week yan. It lasts a week. So, after a week, pag yung
So
iba
pag
kasi,
after a week, hindi pa siya nawawala. kailangan na tayo makipagkita sa dentist.
Kasi it could be something that's more serious than just mouth
Alright.
sore. Mm.
Okay. Kanina na nagchichikahan tayo, you mentioned to me that COVID can also be, I mean, the
Yeah.
first, di ba, first entrance kasi, ano ba tawag doon? Entry point is either the mouth or the the nose.
Oh,
So
yes.
pwede bang pagka meron kang singaw, pwede bang, is it also a sign that you may
Not
have
all the
COVID?
time. Not all the time, but it could be one of the signs. Kasi, as I said kanina, na sores can be caused by viruses. So,
Alright.
usually, pag viral yan, madami yan. Sabay-sabay yan lumalabas, yung sores. So, it could be
So
a
hindi lang
sign.
isa.
Hindi
Hindi
lang
lang
isa,
isa.
madami. Madami.
Mga
Madami siya
ilan
sa
yan? Dito, di ba dito
sa
minsan? Pero minsan
loob.
kasi pag nag-iiba yung bite mo, parang na-bite mo lang siya, iba yon, ano?
Oo. So, sa lips,
Pero
sa
yung,
tongue, you can see that there.
okay. Kasi ngayon, doktora, di ba, parang paiba-iba yung weather. I'm sure yung mga momshi dito, na may mga anak na mga bata pa, as early as siguro mga toddlers or even yung mga preschoolers, usually pag ganitong summer, mouth sore, yung singaw is common. Tama ba?
Yes, oo. Common din naman siya. Oo. Well, not, ako kasi I don't see it as parang seasonal eh. So,
Right.
pero it's
Could
very
be,
common. Kasi people
could
don't
it,
really like,
sorry,
yes.
go ahead. People don't
Um,
really,
especially pag summer, you really need to drink a lot of water. So sometimes pag dry ang mouth natin, and we keep on licking our lips like that, it starts yung mouth sores.
I
Nagka-crack eh.
see.
Oo, nagka-crack.
Oo, kaya dapat mga momshies and popshies, we always have to remind our kids, kahit na paulit-ulit tayo para tayo mga sirang plaka, drink water, di ba? Lalo na pagka nasa harap na sila ng gadget. Ako kasi personal experience ko, I have to remind my bunso to drink water because I feel that when they are so engrossed with what they're doing, or I hope they're doing something, but engrossed in front of their gadgets, they tend to forget. And then when they're so parched and thirsty, that's the only time they drink, diba? Okay. And tapos nakikita ko, bakit ang dry-dry ng lips nitong mga to? Yung pala, it's all because they're already dehydrated. Okay,
Yeah.
so the last telltale sign, let me just summarize. So sa first, sabi, pain that persistent pain that does not leave. Diba? In the next 5 minutes, that does not leave after a week. And then second is also yung ating sore, mouth sore, no? And then also is inflammation. And then fourth is bleeding gum. Tama.
Yes.
The fifth telltale sign.
Okay. Yung pinakahuli, this is yung gumagalaw na yung teeth, mobile teeth. Ito yung teeth na, yes, oo, na paikot-ikot na siya sa loob ng mouth mo. Every time you bite, it moves. Di ba? So,
Especially sa
every time
mga bata, di ba? Yung mga nag-change from
yes,
baby teeth
yes,
to
oo,
adult teeth. It's a common
yes,
experience that they have wiggly tooth.
yes,
Sign na
oo.
magano na. Pag gano'n, kailangan na nilang pumunta sa dentist.
Pag hindi siya if it's moving, kasi hindi siya natatanggal on its own, and then there's the permanent tooth that's growing at the back, then I would suggest that they should go to the dentist. Kasi the longer that the tooth stays there at the back, then it might cause some problems sa dentition nila, yung arrangement ng teeth nila. So hindi siya straight, it becomes crowded. So
doon na nagsisimula yung pagkakasungki-sungki ng mga ngipin.
yes. Pag sa
That
adults
would later
naman,
on.
yes, sa adults
Sa adult.
naman, it's more of difficulty in eating. And then, syempre pag if the tooth is moving, there are spaces all around the gums. So sometimes napapasukan ng food yan, and it might cause infection later on, a bigger problem.
Okay.
Baka
Let me ask you, kasi you mentioned about that napapaso. What about those with experiencing cavity?
mm.
Diba, meron
Oh,
na silang cavity. Tapos, kasi ako kanina shinare ko sa'yo, no? Before the pandemic, meron ng cavity yung aking molar. Third molar. But then sabi ng dentist ko, sige, we'll wait a little while, palakihin muna natin para you don't have to drill too much kasi I hate it. And then naabutan ng pandemic. So syempre, obviously, lumalaki siya on its own. Pero sabi ko,
yes.
buti na lang, it's not being sensitive. So when is the time that talagang kailangan na pagka may ganong cavity na?
So, well, truth is, pag cavity talaga, you really have to go right away. Kasi there are a lot of reasons why we want you to go to the dentist pag may cavity. Um, kaya lang since it's pandemic, as much as possible, pag ganun na, all we can say to you is just to keep it clean. Keep it clean. Try to
Mm.
keep it clean. So brush it, make sure that you floss all around the tooth. Tapos, you do your mouthwash all the time. Kasi syempre, hindi natin maalis sa mga patients now, yung fear nila to go to the dentist. O kaya naman yung dentist nila, baka hindi naman din nag-clean na. So, yun lang talaga. And then, we can do some home remedies. Yun yung sinasabi natin na yung mga warm water with salt, that's a good home remedy also kung talagang hindi ka makakapunta. Kasi the salt is actually a natural disinfectant. So that's
Right.
why we use it all the time.
Okay. So, kanina you mentioned about the kids, no? Having, let's say, yung mga bata with wiggly tooth that has to
Yeah.
be removed kasi meron ng mga nasa likod, no? Pagka
Mm-hmm.
gano'n, I remember, gino-joke kasi ng lolo nila yung anak ko na, o pagka may ang gumagalaw na, i-pull na lang natin yung sinulid tapos i-attach sa pinto pagka gano'n. I mean, or sometimes the kid, because it's so wiggly and the tooth is the root of the tooth is not too mahaba, they can just pull it out like that.
Yes.
Is that something possible also during this
Yes.
time of
Oh yes, yes, definitely. The only reason that you have to go to the dentist if kahit anong galaw ng tooth hindi mo talaga matanggal kasi some part of it is still embedded sa gums. So pero
right,
yung
right.
yung ibang teeth, yung baby teeth na talagang gumagalaw na wala ng roots, it's just the top na nakadikit na lang sa gums. It's okay to remove it at home. Kasi kayang-kaya nila tanggalin yan. Minsan nga, di ba, kumakain ng sandwich, pag kagat ng sandwich,
Ah,
kasama na yung
correct,
ngipin.
correct. Tama. Oo. O minsan, kasi bata pa sila, hindi naman nila na-experience yung pain, di ba? Parang sa
Mm-mm.
kanila, parang normal lang na merong gumagalaw-galaw ng ngipin doon sa
Yes.
wherever, no? Okay.
Oo.
So again, no, let me just summarize for everyone's sake, especially those who have just joined us here. So there are 5 telltale signs when you need to see your dentist. The first is when you're experiencing a persistent pain that does not go away, even with drinking pain reliever. Second is if you're experiencing inflammation, all right, of the gums. And then third is when it's bleeding in a sense that even if you're just brushing it very gently, tapos nagbi-bleed na siya. And then fourth is when there are mouth sores that doesn't heal in a week, because if it's viral most of the time, meron lang siyang natural course and usually 1 week it should be going away. And the last is yun nga, yung may wiggly tooth, either for kids or adults, that does not, yung ayaw mo dislodge, that needs to be
Mm.
extracted already. So, kailangan na ng assistance with the dentist. Doktora, may I ask you kung ano yung mga protocols na pwede mong i-share to our audience right now when they go and visit their dentist? Or what is it that you can share with them to make them feel at peace that it's okay to see their dentist even while we are in pandemic?
Okay, during this pandemic, well, I still say na as much as possible, you stay at home. But kung talagang kailangan na, there are things naman that every dentist na nagki-clinic now are doing to assure everyone that it's safe to go to the dentist.
Mm-mm.
We have all these aerosol suction machines, naka-full PPE naman kami. We do the usual contact tracing, the oximeters, um, yung in my case, I I I wrap everything. I cling wrap everything. So every patient, I remove all the cling wraps in the chair, all the instruments,
In front
everything.
of them, ganon.
Yeah, after them, yes, and then we change it. So, after every patient, we really disinfect
Sir.
the room. So all the floors, the chair, as much as possible, we don't see patients na sunod-sunod unlike before. So, meron yan time in between to give us time to really clean. Kasi nga, syempre, we don't like cross-contamination. And if you notice now, ang mga clinic, wala na siya yung usual na madaming nakalagay na magazine or
Oo
anything na
nga,
they
kasi that can be cause of ano, 'di ba?
yeah,
Transfer
so
of kasi basa-basa, hawak-hawak, ganyan.
yes, tanggal na lahat yon. So if you kung mga ibang pediatric dentist, I'm pretty sure wala na ring toys na nakalabas sa reception
Correct.
area. Yan.
So ano yung doktora? You are by appointment 'yan.
Yes,
Definitely.
yes, definitely by appointment. By appointment kami. Just to make sure that, well, for me, I limit the number of patients I see in a day. Uh,
Mhm.
Tapos, just to make sure nga na the clinic is clean when they go in. So, hindi pwede yung sunod-sunod kasi syempre, hindi natin ma-assure na naayos na or nalinis namin na mabuti yun kung talagang dikit-dikit yung appointment.
Yung isa
So,
pang tanong ko, I'm sure tanong din yun ng mga momshies and popshies, no? May extra cost ba na nire-require ang mga dentists ngayon? Because I remember my tita, the first time she went to the dentist, sabi niya, she has to pay for the PPE cost. Tama ba yun?
merong ibang ganon. They charge for the PPE. But to tell you frankly, a lot of us, of course, increased our fees
All
because
right.
of the additional cost niya ng mga PPE to disinfect and all of that. And since everybody is using the face mask and the gloves, ito mga basic things that cost before na parang sobrang cheap lang is actually like 3 times, 5 times more expensive right now. So we can, that's one of the reasons actually na tumataas. Yung iba, they charge
Siguro,
separate.
just give us lang an idea of from the previous cost. Syempre, alam naman natin kung magkano yung cost ng dental procedure. Sa mga ilan, 20-30% increase?
Hindi ko masabi kasi syempre yung ano, no? Maybe 30-50%, something like that. Increase. Oo.
Okay, all right. So para din naman for the sake of our audience who really have to see their dentist, no? So they have an idea about the cost. Okay. So Doktora, maraming salamat. It's been a very short and sweet discussion, but I hope we were able to share to the rest of the audience the basic information that they need to know so that hindi na sila masyadong mag-worry if they are experiencing something. And also, I hope we were able to communicate very well that it's safe. Go to your dentist if you really must, because they have taken all the precautions just like in the doctor's clinic in the hospitals, and there is no really reason to be afraid, no? So doc, you want to share with everyone where you're holding clinic for those of us or those who are here joining us?
Okay, so if you have time, maybe you want to see a dentist. My clinic is at Jade Hotel and Suites here in Pasong Tamo in Makati.
Ayan, maraming salamat, Doktora Ann. Let's show some love naman to Doktora for all of us here who are still with us. Show some love to Doktora Ann. Bondoc-Irigo. Ayan, maraming salamat, Doc. So, I hope that a lot of you here who's joining us were able to get the basic information that you need to know. And also, if you really need to see a dentist, Dr. Ann's clinic is in Pasong Tamo, Jade Hotel. Tama no? Jade Hotel in Pasong Tamo. Eh, Extension ba yon?
No, no.
No, it's along
Uh,
Pasong Tamo, no? In
yes,
Makati. Ayan,
yes.
sige. Thank you, Doc. Thank you
Thank
so
you.
much.
Thank you
All
very much.
right. Thank you. It's been a very worthwhile afternoon, and I hope you had fun sharing your expertise to our audience also. So, uulitin.
Yes, of course.
Okay, marami. And of course, Ria also says, thank you so much, Dr. Ann. Ayan. Thank you, Doc. Bye.
Bye.
Ayan. So, there you have it. I have already shared with you the 5 telltale signs that you should see a dentist. And I hope I was able to add value to your afternoon. So at this point, let me ask everyone joining us this afternoon and those who are watching this on replay to type in the comment section what is that one problem that you want to be solved. So this afternoon, we shared about dental issues. So if there's anything that you want us to talk about, one problem that you want us to solve, please type in the comment section so that in the future episodes, we are going to prepare and I will be finding someone who can help you solve this problem. All right, so let me close my sharing this afternoon with a story. So I remember this very vividly because when I was a child, I remember that having a toothache is one of those experiences that I never want to have because the pain is so unbearable. And the thought of going to a dentist is even worse. But I had to bear the pain. Nung panahon ko, ayoko nang sabihin kung kailan yon, wala pa nung usong drills na may mga water na lumalabas. So I remember, no, I can hear the drill of the dentist. And then I bear the pain of that seated in an uncomfortable chair, and I even experienced having my tooth extraction by a neighbor who is studying dentistry. So it is why I'm very persistent to my children now to take care of their teeth, and I hope all the mamshies and papshies here should really be proactive in teaching their kids how to take care of their, or how to teach them proper mouth hygiene, and because I don't want them to experience the same kind of pain that I went through as a child. So with that, I hope that I was able to add value to your afternoon. I truly appreciate you joining me today. Instead of going somewhere, spending time with your family, celebrating Mother's Day, you chose to celebrate with me. So maraming pong salamat for joining this afternoon. This has been your Mom She Lumen. See you next week for another exciting discussion. Okay, bye!